So one thing that I realized when we were traveling across the province, visiting people and hearing their stories, healthcare professionals and members of the public, is we expected them to tell us what the challenges were that were facing them in delivering service or receiving service. But I was surprised, not surprised maybe, but I was impressed that they also came with solutions. And they knew what needed to be done to fix the healthcare system. And some of them were innovative, out-of-the-box ideas. Some of them, most of them had common themes. So what I realized was that they're not organized in such a way that they can mobilize action to make those improvements. So by having them come together and develop the clinical plan, and having members of the public as well help co-design that plan, I think that we can definitely start moving things forward in that way. And what I think is we will have to come together and look at external reviews done to date, look at data that we have and understand their lived experiences. Then we will have to decide, prioritize where we want to go and how we're going to measure success. And once we do that, I think having all the brains in the game and contributing, sharing, supporting, and learning from each other, I think there's tremendous opportunity to move things forward.
Lynette, I think it's really encouraging when you look at the infrastructure that's being established as a foundation, namely Shared Health Services Manitoba, and bringing together the clinical leadership on a provincial basis and the consolidation of services in WRHA. There's still this huge landmass of rural Manitoba. How do you see the outreach of what you're doing hitting into the rural communities and making change?
Well, on our clinical teams, which we're just now putting together, there will be lots of representation from rural and northern Manitoba. And some of them have common challenges and some of them are unique, but what I would like is when they identify what their issues are, that we can find solutions, try them in the geographic location, and then spread that success. So there's a lot of pockets of brilliance scattered throughout Manitoba. We heard innovation, we heard success. The problem is that it's really difficult for us to spread that success when we're so fragmented and siloed.
I would just add that the teams that will be coming together provincially to do the clinical planning will be organized around the various specialty groupings, but then we're going to combine specialties in novel ways to kind of take fresh perspectives of the system. But the individuals that we're bringing together from across the province, and yes, there'll be many people from rural and northern Manitoba as well as from Winnipeg, are going to be from all the various disciplines. So it's going to be interprofessional. And one of the things that they're going to be tasked with is looking across the province in their particular specialty area and figuring out what is the most effective service delivery model that will enhance quality and access to care for patients. And think about models of care that more fully utilize everybody's full scope of practice, because there's a lot of changes going on in Manitoba now with the various professions to expand their scope of practice. So it's a wonderful opportunity to take a fresh look at how we work together within the models of care. And then they'll also, as a team, look at, for their particular specialty, where is it important to have consistent standards of practice? And in areas where they think it's important that there be consistency across the province, they'll be developing clinical guidelines and protocols that will apply province-wide. And then the third thing they'll be focusing on is what can we do in the area of recruitment and retention, so that what can we do that perhaps is a little different than what we've done before to ensure that we can recruit and retain the various different types of professionals and staff that are needed to support the model that they've developed.
It's good to hear you talk about the models of care, because the potential innovation that comes with models of care is huge, and it can fundamentally change the way that care is given.
Well, and a very important part of this planning process as well is when the leadership of those teams, those clinical specialty teams, come together under Lynette's leadership and take those various models of care that have been developed for the different specialties and integrate them all. So what we come up with is a very integrated, coordinated, provincial clinical and preventive services plan that will greatly facilitate recruitment and retention. It'll provide a guidepost for planning and human resources, for planning our capital infrastructure and capital equipment, and our further evolution of our digital health system. So all of that is so dependent on having a provincial clinical and preventive services plan, and we've been lacking that, as you pointed out earlier. And so having that, I think, is a tremendous opportunity for us to bring about real improvements in the way we deliver care.
And I can tell you, as someone who's represented rural Manitoba in my time in the legislature and have lived in rural Manitoba my entire life, that's exciting for me, because I know that there are many times talking to those in rural Manitoba who felt that they could share good ideas with others in the province, but also that they needed some support in terms of expertise, and to have a system now that will allow them to both give input but also to receive support that they may not have always received under the system as it exists today. I think should be a great encouragement to those who are living in rural Manitoba, and as somebody who represents rural Manitoba in the legislature, it's a great encouragement to me.
Well, and if you look at the composition of the teams we're pulling together in the various specialties, the majority of those members of the teams will be from rural and northern Manitoba. When you look at some of the most senior clinical committee that's being formed province-wide, which will oversee the planning process, that will approve the provincial clinical guidelines and protocols, that's actually led by a rural Manitoba healthcare provider. And so when you look at the most senior clinical committee in the province that we're forming, it's going to be led by a clinician from rural Manitoba, and many of the members around that table are going to be from rural or northern Manitoba. So we're making a really concerted effort to try to engage everyone in the system, everyone in the province. As you point out, everybody has an important perspective and have good ideas to share, and we want to learn from each other. And I think people are excited about that. People are anxious about change, and of course, it does create anxiety, and change is not always easy. But as we've gone around, even in the last few months, I mean, this idea of working together provincially, planning together provincially, creating a better integrated system, everybody seems very enthusiastic about that, and so we're quite excited.
The great opportunity is if you take in urban Manitoba, where the potential was initially formulated for My Health teams, as an example, then you expand the My Health teams into multidisciplinary and collaborative networks, and then have these teams also linked to the rural part of the province.
Yes.
It can really consolidate.
Yeah, that was a really innovative idea that came out of your report, to take those existing My Health teams that are distributed across the province and have them, in essence, sort of adopt some of the more remote areas and support them. There's all kinds of opportunities that we can tap to better integrate what we're doing.